Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today we have with us Dr. Kaushik Sarmah, Senior Consultant, Dental and Maxillofacial Surgery. Just to tell our viewers that Dr. Kaushik and his team successfully completed a complex surgical procedure for the very first time in Northeast at the Health City Hospital. So, what is the surgery we are talking about? Let's hear it from Dr. Kaushik himself. Thank you so much, Dr. Kaushik, for joining to Good Life, the health show. So, first off, we would like to know about the surgery you and your team performed for the first time in Northeast. What we are talking about? Tell us, our viewers.
Right. We have performed facial reconstruction surgery in Health City Hospital. Like earlier, it was not done in the Northeast part of India. So what we do here, like patient, suppose he has a disease in his hard tissue. Hard tissue meaning your bones, facial bones. And for some reason, he has to lose that portion or part of the bone. So how you reconstruct that? So we use our CT scans and imaging technology with your preoperatively, it's done. And then we plan and design a titanium implant prosthesis, and we place it according to the defect. So this reconstruction was successfully performed in 2 cases till now. So we are looking forward to more.
All right, we'll talk about that experience.
Right.
How was the surgery? What were the challenges? So let's talk about now, what is this facial reconstruction, doctor? If we would like to tell our viewers a generic idea about it, who are the people who will need these reconstruction?
Right. It's reconstruction in simple ways, it's like losing, it's like when you lose something, we have to replace it to maintain the function. Suppose you lose your dental unit, like your tooth. We get nowadays what you call as dental implants. These are permanent solution for the replacement of a tooth. Similarly, for the maxillofacial area, your head and neck region bones, there are specific implants, patient-specific implants, right? So when you lose that area, it is very necessary to, replace that particular anatomical part. So for the better continuation of function.
So what are the procedures? Now we will talk about that experience, but let's talk about if any person needs these facial reconstruction. So what is the procedure? What are the tests being conducted, of course? So how to go with it?
Yeah, so the first stage when the patient comes to us, we send them for pre-operative radiography, it's CT scan, to exactly locate and know the defect, exactly the location, the size, shape, everything. Then we analyze that particular segment. And then we reconstruct it. There's a software for that. We reconstruct it with the titanium frames, just to replicate the bony structure. So after that, it goes to the lab, and then there is processed, and the prosthesis is finally prepared like that. So it is known as patient-specific implants.
Now, how long this procedure takes place? Does it take for a long time? Does the patient and the attendants will have to wait for a long time?
Right. From initial, the workup takes around like 15 days.
15 days.
15 days.
Starting
to
from
get
the
it
test
ready.
To get,
and then we can we proceed towards the patient, investigation for the whole surgery, routine blood, everything is done. And then when fitness is given, then we perform the surgery, and post-op surgery, 15 days we keep a period for observation.
So those are the precautionary measures which you give when the patient is being discharged. And you also write all the do's and don'ts of what to do and what not to do. So are there any major precautionary measures that the person has to take?
In case of
like after the surgery?
After the surgery, patient is at a hospital care, you were kept for 48 hours and then you were discharged. Then instructions are given which are like your daily, it's very easy to maintain instruction, like a normal saline water wash, and
Okay.
we give the food habit instruction and your regular medication. So within 15 days time, he is fit almost to get the dental component.
Okay.
Right.
Now, talking about the food habit, does the person feel it difficult to intake food and water after the surgery is being performed?
Initially for 48 hours, little bit.
Okay.
Yeah, then he can start with the soft diet, complete soft diet.
Okay, okay.
Right.
So the dietary part and the dietitians perform their duties well.
Right.
Now, if we talk about your experience, the surgery which was performed for the first time in Northeast, please
Right.
tell us something about that patient. How did you meet the patient and what not?
Right. That patient was from Johar.
Okay.
And she was 69 years old, and she came to our OPD with an issue that she had, due to her age, vertical height of the bone, the mandible, the lower jaw was reduced. So she couldn't go for dental implants.
Okay.
Right? So she came to us facing the problem of eating. Her major problem was eating.
Eating, okay.
So we have designed this thing, as I explained to you, patient specific implants, and she agreed to it. We went through the test, all went good, and then we performed the surgery.
Okay. Now, the age you talked about is an age like you need to be very careful about, because you're talking about 65 years of age. So what were the challenges that you and your team faced while performing the surgery?
Right. See, regarding these titanium implants, I would say there is no age limit as such. When you are adult, like we have done cases from like 21 till, personally I have done till 75 years of age. So provided they meet all the medical, criterias, like to undergo the implant, there is a criteria in every surgery. Like for prosthetic implant surgery, there is a criteria. If the person meets that criteria, it's well and good.
Okay. Now, doctor, technologies have advanced. So can we assure the patients and the viewers that, of course, we also perform such kind of critical surgeries as well in
Right.
Northeast as well.
Right.
So the technologies have advanced. So that assurance can be given to the patient as per the attendance as well.
Right. Very much. And it's at various centers we are like, it's coming up now. At a very fast rate, it's coming up. That's
Okay,
very good
so
to see.
things are coming up and technologies will be advanced, and we are having a fruitful discussion. So please call up and ask your question if numbers are flashed on your television screens. Now, doctor, coming back to you again, we will have a generic idea about the dental problems as
Right.
well. But this was actually very impressive when you and your team performed this surgery for the first time in Northeast. And
Right.
of course, the patient, when she walked after the surgery, when she was discharged and when she was happy. So what was the response from their family members and from the patient as well after the surgery was successful?
Oh, now it's been like 2 years and we are in contact. She is very happy. She is eating. She came for reviews and all that, and she is healthy.
Okay.
That is the best thing. And her family members, of course, are very happy to see her in a very happy state of mind.
Okay. Now, doctor, we'll talk about other problems as well. Now,
Right.
let's talk about what is this dental implant and who are the persons who will need these dental implants?
Yeah, like this maxillofacial implants, there are dental implants which replaces your missing tooth, right? Only the tooth component.
Okay.
So these are permanent options for replacing a missing tooth, right? So, but for dental implants also, it's very patient specific. There is a criteria for that also, right?
Okay.
Like for an example, I can tell you, if you are a diabetic patient, you have high sugar level, uncontrolled, that is a complete no-no for your implants.
Okay.
So there are things like that.
So a lot of factors are there.
Right,
So when
exactly.
you perform those implants, so you of course take the history of the patient as
Right.
well. That is very important. isn't it?
Exactly. And the thorough investigations.
Okay. Now, importance of tooth, that is very important. So what would
Right.
you like to tell our viewers on that?
Oh yeah, tooth, lot of people have this thing that tooth is just for chewing. It is the basic thing for our digestion. Once tooth is compromised, digestion is compromised.
Okay.
And then a lot of people have this thing that something is wrong with my stomach. So a lot of time it starts from your oral health. So you have to focus on a proper hygienic good oral health. Now the functions when you come, it's about the chewing one and the speech. It helps in speech. A lot depends on your dentition when you speak, right? So, and it gives it's very essential part of your profile, patient profile. So earlier, dental caries tooth, when they used to see black spot or something, they'll just pluck it over. They'll go for extraction. You're not supposed to do that.
Okay.
Right? Tooth is a main supporting part of your upper and lower jaw. So your facial profile depends on your tooth.
So that can be cleared without extracting?
Right.
Okay.
Nowadays, conservative dentistry has gone so much, and microscopes and all, you can easily go and save a tooth.
Okay.
All right. So for that, you have to have the specialists in your unit.
All right. And one should not wait for the last part, because like if you have problems initially, you should immediately visit a dentist to rule out the problem so that the treatment can be started at the earliest.
Exactly.
Okay. Now, doctor, dental hygiene is very important.
Right.
Of course, children have been taught about it. Now, what would you like to tell about dental hygiene? What are the do's and don'ts? Of course, the basic idea everybody has, but on your part, what would you like to tell?
Children's at a very early age, I have seen in our clinical practice, one of the most common thing is early childhood caries. It's a lot of cases are there. So what is the main reason is maybe because of negligence or maybe unawareness. When a kid goes to sleep, he has to wash his mouth. So night mouthwash is compulsory, because once they are suppose they are in breastfeeding stage, so the whole night the microbacteria, they keep replicating. So you have to maintain a good oral hygiene, because they cannot talk, they cannot express things, right? So it is very necessary to keep a clean oral environment for the infants.
Okay.
Right? So when the deciduous tooth or the milk tooth, they say, they come out, you will see a lot of kids having a blackish nature in all the tooth. That is called the early childhood caries or rampant caries.
Doctor, we'll talk in details about that early childhood caries, but we'll have to take a break.
Sure.
All right, viewers, we'll slip into a short break, but do come back soon, because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on various dental problems with Dr. Kaushik. So, Dr. Kaushik, coming back to you again. Earlier to break, we had a fruitful idea about dental implants as well, and you were talking about children carrying caries at very early age. So, you have mentioned about the reasons. Now, what are the precautionary measures? How will the parents take care of it?
So, as I said, they should make sure that whenever the kid is going to bed, he or she is assisted, or he or she is assisted with a proper mouthwash. Or mom can, use her index finger. There is a way the dentist will teach her.
Okay.
So that should be maintained every night.
All right.
That is main thing.
That is the main thing. Okay.
Yeah. One more cause I would like to add is the duration of breastfeeding. Like lot of patients I have seen, when we interact, they give a history of breastfeeding for like 4 to 5 years. So that maximum age is 1.5 years.
Okay.
That should be told
so those are the measures or
common
those are
factors.
the common factors for this early
childhood caries.
Early childhood caries. Now, doctor, talking about the products available for the tooth. Now, products, there are a lot of products available in the
Right.
market, which one to choose and which one to not. So a lot of confusions in everybody's mind. So as dentist, what would you like to suggest the patients or the general people who are watching our show? Is it always the medicated ones to use or the other products? What are the things that has to be taken account of?
Not always medicated. Like I would say when suppose when you are selecting a toothbrush, you should always go for the soft or the ultra soft ones, because it all depends on the diameter of the bristles. So if you use the hard or the medium one, these kind of is injurious to your gums and the tissues later on, which causes infection. So I usually suggest all my patients to go for soft or ultra soft brushes like that, and you just make sure your toothpaste is fluoridated,
Okay.
right? Whatever you are using, just make sure it's fluoridated.
Okay. Now,
Right.
doctor, there are a lot of common dental problems which is
Right.
seen in pregnancy as well.
Exactly.
Now, when a lady is pregnant, so a lot of
Right.
things has to be taken care of.
Right.
If you talk about the common dental problems, because they won't be able to take the common medicines at any
Exactly.
time. So on that note, what are those common dental problems, doctor?
During pregnancy, I would like to say the main thing is you should avoid any surgical or dental intervention in the first and last trimester,
Okay.
right? So that is one thing to be kept in mind, and prior to when you planning a pregnancy, you should go for a thorough oral checkup, right? That will keep your any emergency dental away, visits away. So now coming back to the changes you get during pregnancy, there is a hormonal change in the body, estrogen and progesterone shoots up. So that time you will see changes in your gingival health, right? There is a increased gingivitis and periodontitis, there is increased bleeding gums, pain in the gums, swollen gums. So basic, our aim is to keep the infection level low.
Okay.
So we have to make sure there is a proper mouthwash, saline. Night time you can go for saline mouth rinse, and then occasional uses of mouthwashes, right? So basic precautionary thing you must follow, twice brushing, right?
Okay. Now, if any infection occurs, then what, doctor? What treatment is being prescribed to the patients who are pregnant?
Yeah, so that has to be dealt in the second trimester.
Okay.
So when that's why I said before you go for a pregnancy, always go for an oral health checkup. So once you are into the process, you don't face immediate any
You will have
dental
an idea.
emergency.
Yeah, you will have an
Right.
idea actually.
Right.
Okay. Now, several like precautionary measures you have mentioned, doctor. Now, if we talk about the patients with common dental problems which visits you every time, what are those common dental problems? You get a case history or every day you need to tackle those? What are
Right.
those common problems?
Like fractured tooth, and then one of the most common I get is impacted third molars, last molars.
Okay.
Wisdom tooth is
wisdom
one of
tooth.
the most common.
Now, this wisdom tooth, actually talking about it, like anytime or anywhere, like you don't have a proper time for that pain or that irritation. So, if we talk about wisdom tooth, how to take necessary precautions for that as well, and there is no age bar for that wisdom tooth. So, what would you like to tell about that, if you need to put some
Yeah.
light on that as well?
See, the wisdom tooth, one thing is, if it doesn't come out into your oral cavity by the age of 21, properly erupts. If it doesn't erupt, then it's not going to erupt after 21 of age.
Okay.
So it may be partially erupted, it may be completely unerupted, it may be embedded inside the bone. So if it is, you can see it's partially erupted or it's giving some pain in that area, you should immediately go to an oral surgeon, get an X-ray done, and just rule out the thing.
Okay, okay.
Right?
We have
That
seen that several people, like they perform some medication at home itself, like putting a clove oil or
Right, right.
putting a clove there.
Yeah.
So is it prescribed, or initially that can be done, but
Yeah.
of course later you have to visit some
Yeah, as you say,
specialist.
that is the main thing. People will first go to the pharmacy and they will ask for an analgesic because the pain is severe. So once they get the relief, they tend to forget the thing, right? So what I want to say is, if you forget to treat the main pathology, the second time when it comes, it will come in a very aggravated way. The infection is still there. So you need to treat the main infection first.
So we need not suppress the pain if it
Right.
goes with the time, but at
yeah.
least you should go and see a specialist.
Immediately. It has to get treated, followed by analgesics.
So, doctor, just quickly, if we need to treat the wisdom tooth, what is the procedure? What are the things being done?
Yeah, first they will take a radiograph, that is called the OPG. They will check the position, location, and it is done surgically in a dental chair. It's not done under general anesthesia.
Okay.
And there are few conditions where general anesthesia has to be administered depending on the level of impaction the tooth is undergone. So after assessing all this, it's a surgical procedure done, and then patient can continue normal food eating habit within 5 to 7 days.
Okay, few patients are there, they must be scared also of visiting a dentist
Right,
to perform
right.
these
Lot
kind
of-
of treatments as well. Of course, you must have also gone through with these patients as well. So any example or any story you want to share with us at this point in time?
At this
Anyone
point,
like you need to handle?
I am very bad at that.
Okay,
I myself,
but it is tough
I-
actually to treat those patients who are scared and
Right.
when they come to you, but you need to treat them. And there are also a few patients when they go back, they forget everything, like they don't take the medicines on time, or if they are properly okay, so they forget to take the medicines which have been prescribed by
Right.
the specialist as well.
Yeah, yeah. You should not actually never neglect or forget the medication part,
Medication
because
part.
once you never know how the microorganisms are behaving inside your bloodstream, right?
So the time period has to be
it's very
completed
important.
properly.
It's very important to stick to your antibiotics and the amount of antibiotics and analgesics you are taking, because it affects your body, right? End of the day, you are ingesting a chemical.
Okay.
Right? So that has to be monitored.
Okay. So are antibiotics always being prescribed to patients before performing any kind of implant, doctor?
Antibiotics, yeah, usually we go for pre-procedure antibiotics. For implant cases, yeah, we do.
Okay. And if we talk about the dietary part, now what about the food habits? Of course, the lifestyle has changed.
Right.
Now, on the food habits, what prescription or what suggestions do you give?
Like, you mean to say post-implant?
Yes, yes.
Yeah. Food habits, as I said, it has to be soft diet. It has to be high in proteins and carbs, of course. With we put them on high calcium diet also. Of course, supplement medication will be there, vitamin D and calcium, which is very essential for your bone. And we give high dairy products, milk products.
Okay.
So those kind of advices are given.
So dairy products are yes?
Yes,
Okay.
of course.
Okay.
Milk.
And if we talk about the revisits again to have a recheck-up, so
Right.
when do you suggest them?
So first, we call them after 7 days.
Okay.
Right? So we do the necessary whatever your suture removal and irrigation and dressing has to be done.
Okay.
So after the first visit, again we call them after 15 days.
Okay.
So that's where we actually assess with our second round of investigations.
All right, doctor, we are really short of time. So what message you would like to give our viewers who are watching our show?
Don't forget to brush twice before you go to bed. Morning once, night once.
Okay, a proper message and a very simple and a basic message. Everybody knows about that. Thank you so much, doctor, for giving
Thank you
us
so
those
much.
lovely messages. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.